Dr. Tyna Moore is a naturopathic physician and chiropractor who specializes in root cause medicine. She took over the practice of her mentor, a renowned naturopathic physician, after his passing in 2013. Dr. Moore's approach focuses on treating the individual rather than just the disease, aiming to restore homeostasis and optimize overall health. Her practice primarily deals with musculoskeletal medicine, chronic joint dysfunction, and regenerative injection therapies. Dr. Moore explains that naturopathic medicine differs from traditional allopathic medicine in its approach. While allopathic doctors follow algorithmic standards of care for specific diseases, naturopathic physicians treat the whole person, considering factors like hormones, nutrition, and lifestyle. The goal is to optimize the patient's overall health so that symptoms and illnesses naturally subside. A key focus of Dr. Moore's work is addressing metabolic dysfunction, which she believes is at the root of many modern lifestyle-induced diseases. She explains that metabolic health involves the body's ability to properly assimilate nutrients from food. When this process goes awry, it can lead to insulin resistance, prediabetes, and eventually type 2 diabetes. Dr. Moore emphasizes that this progression has become normalized in society, with intervention often coming too late. Dr. Moore shares her own health struggles, including chronic pain, autoimmune issues, and mental health challenges from a young age. She attributes many of these issues to poor nutrition and exposure to processed foods. Her personal experiences have informed her approach to treating patients and understanding chronic pain. A significant portion of the conversation revolves around GLP-1 agonists, particularly semaglutide, brand names like Ozempic and Wegovy. Dr. Moore discusses how these medications, originally developed for diabetes and weight loss, have shown promising effects beyond their intended use. She argues that when used in microdoses, these drugs can have regenerative and anti-inflammatory effects throughout the body. Dr. Moore advocates for microdosing semaglutide, using much smaller doses than typically prescribed. She believes this approach can provide benefits while minimizing side effects. Dr. Moore explains that microdosing can help with various conditions, including chronic pain, autoimmune disorders, and cognitive issues. She emphasizes that this should be done under medical supervision and in conjunction with lifestyle changes. According to Dr. Moore, research and clinical experience suggest that GLP-1 agonists like semaglutide may have positive effects on various health conditions. These include potential benefits for type 1 diabetes, Parkinson's disease, Alzheimer's, depression, anxiety, and even cancer risk reduction. She also notes improvements in gut microbiome and fertility issues like PCOS. Dr. Moore explains that GLP-1 agonists work by mimicking a naturally occurring hormone in the body. They affect various systems, including appetite regulation, insulin sensitivity, and neurological function. She emphasizes that these medications don't just suppress appetite, but can have broader effects on metabolic health and inflammation throughout the body. The podcast addresses some of the controversies surrounding GLP-1 agonists, including concerns about side effects and long-term safety. Dr. Moore argues that many of the reported side effects are associated with higher doses and rapid weight loss, rather than the medication itself. She advocates for a more cautious, personalized approach to dosing and emphasizes the importance of lifestyle changes alongside medication use. Throughout the conversation, Dr. Moore stresses the importance of a holistic approach to health. She outlines several key factors for optimal health. Strength training and movement. Dr. Moore emphasizes the critical role of strength training in metabolic health. She explains that muscle is essential for insulin sensitivity and overall metabolic function. She recommends incorporating strength training exercises, even simple ones like bodyweight exercises or lifting household objects, into daily routines. Nutrition. Prioritizing protein intake and focusing on nutrient-dense, whole foods is a key part of Dr. Moore's approach. She advises aiming for 30 grams of protein 3 times a day and incorporating a variety of colorful fruits and vegetables. Sleep. Quality sleep is crucial for overall health. Dr. Moore discusses the importance of sleep hygiene, including consistent sleep schedules, creating a proper sleep environment, and addressing factors that may disrupt sleep, such as snoring partners or excessive light exposure. Mindset. Dr. Moore highlights the importance of a positive mindset in achieving health goals. She encourages viewing health improvements as a journey rather than focusing solely on end results. The conversation touches on broader environmental factors affecting health. Dr. Moore expresses concern about the prevalence of toxins in food, beauty products, and the environment. She believes these factors contribute significantly to the current health crisis, including fertility issues and metabolic dysfunction. Dr. Moore discusses a looming fertility crisis, citing declining sperm counts and increasing difficulty in natural conception. She links these issues to widespread metabolic dysfunction and environmental factors. She suggests that addressing metabolic health could be key to improving fertility rates. When asked about the lack of long-term studies on microdosing semaglutide, Dr. Moore acknowledges the need for more research. However, she argues that the risks associated with microdosing are likely lower than those of high-dose usage or leaving chronic health conditions untreated. She emphasizes the importance of personalized care and close monitoring when using these medications. Dr. Moore shares her personal philosophy of always seeking knowledge and remaining open-minded to new information. She encourages listeners to do their own research, verify information, and not simply follow influencers or accept information at face value. In closing, Dr. Moore reflects on her career path, acknowledging that while it has been challenging to advocate for sometimes unpopular opinions, she is proud of the impact she has made. She expresses a deep commitment to helping people and making complex medical information accessible and actionable for the general public. Overall, the conversation with Dr. Tyna Moore provides a thought-provoking look at alternative approaches to treating chronic health conditions. While some of her views on microdosing GLP-1 agonists are controversial and not yet fully supported by large-scale clinical studies, her holistic approach to health and emphasis on addressing root causes of illness align with growing trends in integrative medicine. The podcast encourages listeners to consider new possibilities in healthcare while also emphasizing the importance of critical thinking and personal research in making health decisions.